Well, hey, and welcome to The Compass, Episode 2, Guidance for Your Journey. My name is Tyler Feller with Brad Robison, MD and Associates. And today we have two of our wonderful therapists with us, Elisa and Gloria. Hey, why don't you guys take a second and just tell us, how did you get started in this field?
Okay, well, I'll go first. So I got started in this field a little non-traditionally. So my background is in music education. And so that's historically what I was trained in. But through a series of life events, I wound up discovering that I really didn't have a passion for teaching. And so at one point during a job that I had in the classroom, I realized that I was far more drawn to the little boy who had trouble keeping up.
Yeah.
Because I learned later, because he had his eardrum busted by his dad, and he was staying in the safe house, and or the little boy who was on the floor and nonverbal. There were just some kids that were falling through the cracks, and so I became very concerned about them, and that was kind of the beginning. And then just the doors opened up. I went back to school and was really drawn to the psychology classes, and had an opportunity to enter the counseling program and got a graduate assistantship, and ended up, my first job was with adults and with the chronically mentally ill population. And so I did that for a number of years and really learned, I think, in that position, like how to slow down. Because, usually you hit graduate school with the accelerator on and let's accomplish, achieve. And in that position, I had to really rethink that. And then I was invited to join a collaborative interagency team that occurred at a school that's no longer even there, but it was in the south part of Cape. And I was the play therapist component. Had never worked in a therapeutic capacity with children before. Early on, I taught kids how to play Orff music, so we had a lot of rhythm and community work in that regard. And I have my own children, but so this was brand new, and I felt like I was ill-equipped to deal with some of the issues that I found. And there were a lot of really serious issues, a lot more than anybody knew. So then I went about looking for opportunities to learn, and wound up becoming registered as a play therapist through the process of over 2 years. At that point, the registration process was not as streamlined as it is now. And so back then, I had to travel on my own dime to different states and just kind of hodgepodge courses together. Now, it's really a streamlined situation to become a registered play therapist. So Elisa gets to take advantage of some of those improvements in the field. So I did become a registered play therapy supervisor. And so I worked with children in the school capacity, and then later went into private practice, and later worked with families who needed extra tools to help keep their kids in the home because of situations of abuse and neglect. But now I've been with Dr. Robison for the last 13 years. I see children. I am a registered play therapy supervisor, but I don't only see children.
Yeah.
So I see couples, adolescents, individuals.
Oh,
so that's kind of a long version of how I ended up as a therapist.
Well, that's
and then
good.
I met Elisa. Yeah.
What's your journey been like, Elisa?
So it's really interesting. Gloria said she came in sort of the backside of being a therapist, and I did too. I was an art educator for 14 years. And even whenever I was doing my student teaching, the collaborative teachers were like, you really work well with the behavior students. You're very patient and very calm. And those were the kids that I would gravitate towards. And then also as an art teacher, you know, I would see a kiddo draw something that was like, I wonder why they drew that. I wonder what caused them to express themselves in that way. And so then I would share it with the school counselor and the principal,
Mm-hmm.
because I recognized that there was something going on.
Yeah.
And so that really interested me. And in my undergrad, I took lots of psychology courses. And in high school, I took psychology courses because it interested me. But I decided to be an art teacher. And then after 14 years, you know, life happened, and I decided to go back to school and get my master's in school counseling. And then I took the exam. I thought I was supposed to be a school counselor, but in fact, I was supposed to work in the agency and in private practice. So I got my master's in school counseling, K-12, and then I got my EDS, which is a specialist in counseling, so I can teach collegiate level courses. But really, play therapy is where it's at for me, because children communicate through play, and that's where they express themselves. So through art, through play, that's where they find their voice. And so that's why I like getting to work with them in that capacity. And I have a lot of work in the play therapy realm, but I'm grateful that I get to work with Gloria to complete my hours. Like I have lots of experience, but I don't have the documented hours. So I'm working on that, and being able to work here at Dr. Brad's, I work with ages like 3, 4 up through 11, 12 years of age. And it's just exciting to be able to come alongside a family and their kids and be able to see them grow and experience success, but then also be able to be there with them whenever they're experiencing tougher situations.
Now, I am totally new to the idea of play therapy. I've had a conversation with Dr. Brad briefly about it. One of the ways that he began to describe it is play is the shared language amongst all kids. And I thought that was a really profound way to really talk about how you can get on their level and communicate with them in a way that makes sense. How would you describe it, and what are some of those breakthrough moments?
Yeah, I think he described it well. I mean, you know, you can go back as far as Plato, and there have been documented situations where play is universal and it's necessary for development. Not only socioeconomic development, or, you know, socio-emotional, I mean, not economic, but motor, physically, intellectually. So play is universal, and it is the language of children. I think sometimes there's a misconception of what play therapy is, you know, because when we think about things like speech therapy, you teach children or people how to speak. We sometimes need to educate people about what is play therapy. So it's not really helping the child play better. And it's not talking to them about how to handle their anger while they play. It's not doing worksheets, right? So it's easier maybe to say what it isn't than what it is. But to me, what play therapy is a way of entering the child's world and being present with them. And it's really interventions based on a clear theoretical model that the children will take you where they need to go. And it's kind of an inherent trust in the process that they have the ability within them to solve problems if given the time, tools, and environment to do so. That's kind of the grounding place. And so I have so many examples of children that take me. So here's one. Sometimes I'll meet a family. The mom and dad will come to me, and the child's in the waiting room. And the mom and dad will say, "Now, don't tell Johnny anything about the divorce. He doesn't know." You know? And so I'm like, okay. So the child comes in the room, and the first thing he does is get the dollhouse out, and the mom and the dad, and they're fighting, and they're like, we're getting a divorce. So children know, they
Yeah.
already know more than we think they do.
Yeah.
And basically, when you work with children, you're also working with parents.
Right.
So I think that applies to parents. I have a lot of respect for parents and believe that they're doing the best they can as well. But with a child in a session, the main thing I want to communicate to them is that I see you, I hear you, and I accept you.
Yeah.
Right where you are. So I don't know if there's anything
Well, so
missed
no, I think you hit everything, said everything exactly where it needed to be. A lot of times, kids don't have the cognitive ability, and they just don't have the information in their mind and the vocabulary to be able to say things. And even if they say the words that the parents are like, such as, don't tell them we're getting a divorce, the kids may not understand what maybe the word divorce means, but they hear the word, and then they can show what their experience is. So I really see, and even back to the cavemen, to try to communicate, though there wasn't words that were the common language, art was the common language, so you could express those emotions. And so it's the same thing with play. You give the kiddos different mediums, whether it's dollhouse or sand tray, Play-Doh, paint, pencil. They're able to communicate, even if they don't know why they maybe are feeling what they're feeling. They can show what it is that they're experiencing, and then as a therapist, you can sort of give them the framework so that then they can learn how to express themselves.
Now I'm curious about it a little bit, because it sounds like you're allowing children to come and have a way to articulate what's inside of them, put words to it using toys. But how do you communicate back with them? Are you in the dollhouse and you're doing that?
Yeah.
Walk me through some of that.
Sometimes you have to start kind of with a lot of tracking and reflecting and just being present and observing and not labeling, because you might be wrong. But sometimes I'll enter the play with them. Sometimes they'll invite me. And so, sometimes you're right there with it. Sometimes it's helpful to throw out a couple of words like, I wonder, I notice, tell me more about this, or show me what this is like for you. We both really love the medium of sand tray, which is a very expressive kind of tool. Art, sand tray, poetry, all those music, all those things that come out of our subconscious, really help, show what's going on under the surface. So sometimes we'll enter in, or sometimes we'll say, I'll grab a puppet, and I'll be the puppet observing, what are you doing here? I wonder about that. And then they'll kind of join in at some point. So
for sure.
Yeah.
We have different assessment. There's lots of theories and theoretical components and assessments that have been created by counselors and therapists in years past. And, we use those to sort of give us a little bit more of an idea of what possibly, the child is trying to communicate.
Yeah.
But everything is original to that child. So there's no real black and white, if you draw this or you do this, then this means this. Yeah. It just sort of gives you a little bit of a framework to try to be able to help see what they're trying to communicate and see what their puzzle is.
Yeah.
Now, what types of families would be bringing their children in for play therapy sessions?
Yeah, all types. All types. That maybe part of your question is maybe what kind of issues would we see?
Yeah, that's a good way to say that.
I see, and I'm sure Lisa too, a lot of times if there's a disruptive behavioral set or some kind of behavior that happens at school, to get the child maybe at risk of not being able to attend there anymore, or if there's some aggression or anxiety that manifests in a child, avoiding situations, that is a frequent issue. there's been a lot of anxiety, especially since COVID, a lot of isolation of children, and it's really disrupted a lot of their normal activities. And
well, and even something that I've noticed as an art teacher, a former art teacher, I look at their artwork, and so and I work in an agency setting as well, and so when COVID hit, and then I started at the agency in July of 2020, the children's self-portraits had changed. Yeah. And I was like, why do they keep drawing people with squares on their faces? Yeah. I didn't understand. And then I was like, oh, they're face masks. And so that's something that we have had to sort of work through, because, you can have your face mask on and you can have this, you don't have to show your emotion, or you can show your emotion, but nobody would see your emotion. And so it's definitely changed the developmental curve of kids and their emotions and communication.
Oh, I'm sure COVID is an enormous marker and a shift. I was going to ask you, Gloria, you were first certified in play therapy in the year 2000. Well, that's 22 years ago. How has the landscape shifted from the year 2000 to 2022?
Yeah, I guess I would say it's both different and the same. I mean, it's different in the sense that there's a lot more people doing research and, coming up with techniques and approaches, but the basic premises are the same. Yeah. The basic premises of what children need to grow and develop it to be whole human beings.
Have you seen any more prevalence of certain issues in that time span, or?
Mm-hmm. Yeah, I have a lot of anxiety personally. That's and it might be partly the clientele that we see here. It's different than I saw at the school, for instance, because people at the school couldn't afford to seek out services. But things like the school shootings have made a huge impact. Just the political environment of uncertainty in our day. Lots of worries. Lots of worries that kids don't understand. Trauma, I've done a fair amount of work with kids in trauma. And while it's really fascinating, and it's very sad, I do see many examples of hope that come through as children work through the trauma that they've experienced. Yeah. So, I mean, those are some of the issues I've seen in the 22 years I've done this. Gosh, I sound old. But
she started when she was 5.
Yeah, exactly. Yeah. So I think, though, there's more communication now, and the resources are more available. You can easily find things on YouTube, podcasts, a lot more than when I was just getting started.
Well, and I think also something that I've spoken with, we've talked about it, and my peers and who are counselors as well. Though I just started, I'm excited. Sometimes I'm like, oh, I wish I'd done this like for my whole career. But I trust I trust in the timing, and I trust the process. And it's exciting that I am sort of starting at that point where the stigma is being broken. Yeah. And it's okay to talk about anxiety. It's okay to have all of your feelings and to cry and express those. And we're seeing, and we learn, and we understand and accept that it's dangerous to just keep shoving down those big emotions. So it's an exciting time to be able to help those families, and they're recognizing, like, we're grateful for everything we had in the past, and it's exciting to be able to learn the tools to move forward, to just continue to better with each generation.
I think that's really important, because from my vantage point, growing up sort of in that era, there has been a release of stigma for people to enter into therapeutic relationships or helping relationships. And then on top of that, there's a huge level of access to information. I know Dr. Brad and I was talking in particular about the OCD issue, and he was saying some of the parents that come have like a PhD in OCD because there's such great access to information. And I think that that's really powerful. So when we talk about the holistic view of what a child needs and understanding, especially as divorce is more prevalent, trauma is prevalent, anxiety, that they're able to come and talk about that, and the parents are well equipped to walk them on that journey too. So, any last words on play therapy that you guys want to share today?
I love play therapy. It's fun. Like I'll message Gloria after I complete a session, and I'm like, that was the best. I love my job. Just because, yes, for me, I work with kids, and I have worked with some of the most brilliant humans. They're just pint size.
Yeah.
And it's exciting to see them make the connections, because, it's sort of like, you're sort of like giving them a carrot, and you're not going to give them the answer. They're going to find it on their own. And so you get to see these really incredible light bulb moments and growth moments in their heart. Like, you did that, and just giving them that power and that empowerment. And you get to do it through play. So, it's fun.
Yeah, it's the best. It's really cool when you see your clients bringing their children back to you.
Yeah.
That's been kind of fun. I've had that happen a few times, but there's nothing more satisfying and purpose giving than feeling like you've allowed another person to feel seen and heard and accepted.
Yeah. Wow. Well, that's so powerful. Thank you, Gloria and Elisa, for your time today. You can call 573-334-7055. Mention play therapy if you're interested in signing up or getting your child in with an appointment. And this is episode 2 of the Compass Guidance for Your Journey. Thank you so much for joining us.
Thank you, Tyler.
Thank you for what you're doing.